Nursing care delivery, planning, assigning, supervising and teaching. Learning outcomes. The learning outcomes for this presentation are to identify factors influencing the delivery of patient care in a variety of settings, to describe the types of care delivery systems, to explain the role of the charge nurse and staff nurse, to reflect on the role of the RPN in planning assignments, assigning care and supervising others, and teaching others, as well as list the legal consideration when assigning, supervising and teaching. Effective staffing roles and responsibilities. One of the biggest challenges facing nursing and patient outcomes is the way care is delivered. Factors that must be considered are the work environment, the nursing care delivery system, staffing and scheduling. Many of the pressures influencing healthcare delivery include cost of care, efficiency, quality and safety. As you watch and listen to this video, consider these questions. What types of care delivery models have I been exposed to during my clinical rotations? And which type of model supports RPNs working to full scope of practice while ensuring cost effectiveness, efficiency, quality of care, and patient safety? Models of nursing care delivery have changed over the years. Many years ago, nurses used a functional model, which divided tasks to be completed between nurses. For example, one nurse would give the medications to all the patients. Where might we observe this type of delivery model today? This model is still evident in long-term care, as the unit charge nurse typically provides medications to all the residents. Another model is the total patient care model. In this model, the RN is assigned a number of patients. This patient care assignment typically only lasts one shift, and the nurse may have different assignments on the next shift. What are the advantages and disadvantages to this model? One advantage is that the patient receives continuous, holistic care provided by a registered nurse. Some disadvantages are that the tasks could be done more cost-effectively by an educated and trained, but less educated, care provider, and that the nurse could therefore be better utilised. From this model of care, the primary nursing care model evolved, and it is still present in our healthcare system today. In this model, the RN retains a patient assignment and is responsible for the allocation and assignment of care of these patients. We see this in some hospitals where there is a limited number of RNs who take on the role of charge nurse. An advantage of this system is improved coordination and continuity of care. However, a disadvantage is that it may require excellent interprofessional communication skills, and it assumes that the RN delegates care to other care providers such as RPNs or PSWs. According to the current scope of practice, RNs and RPNs collaborate, but are autonomous in their care decisions. Only specific tasks and skills may be delegated by the RN to another RN or RPN, and RPNs have the authority to initiate client care decisions independently as long as they have the knowledge, skill, judgment, and experience. Please see authorizing mechanisms. The most current models most evident in our healthcare system are a combination of differentiated practice models and patient-centered care models. These models of care maximize cost effectiveness while promoting patient safety. In the differentiated care model, the most appropriate care provider is assigned to care for the patient, as this model supports task delegation. For example, the patient may be an RN or RPN appropriate. Therefore, cost effectiveness and scope of practice suggest the RPN may be the most appropriate care provider at this time. The RPN, while caring for the patient, may choose to delegate a specific task for this patient to a non-regulated care provider. An example of this might occur on a complex continuing care neurological unit. A patient is recovering, the patient's condition is more stable and outcomes more predictable, making this patient suitable for the RPN. The RPN caring for this patient chooses to delegate the personal hygiene, toileting and feeding to one of the unregulated care providers employed on the unit. This enables the RPN to spend more time on complex nursing care such as health teaching, discharge planning, medication administration, and rehabilitation interventions. Patient-centered care models are gaining momentum. In this model, a team of healthcare professionals deliver patient-centered care on a particular unit. This model is based on the interprofessional practice model of care and is known as interprofessional collaboration. An example of this is the newly opened respiratory unit in RVH. The interprofessional team includes respiratory therapists, social workers, dietitians, physiotherapists, occupational therapists, and nursing. This new unit's multidisciplinary team approach means a wide variety of healthcare professionals will work together and will focus not just on treatment for these patients, but also on prevention and education. There are multiple roles for nurses, from the staff nurse providing frontline care to the chief nursing officer for the province. We will focus on two specific nursing roles, the charge nurse and the staff nurse. RPNs, depending on the setting, may function in the role of charge nurse. A charge nurse has more responsibility than a staff nurse and supervises other staff and liaises with the nurse manager. The position of charge nurse may be permanent and assigned or may rotate between experienced staff members. The job description of the charge nurse varies from organisation to organisation. However, the expectations required of a charge nurse include role modelling, mentoring, assisting, assigning, teaching, supervising, and delegating. More commonly, RPNs function in the role of staff nurse. In this role, the RPN will still need to demonstrate management and leadership skills. The role of the RPN as staff nurse includes supervising others to ensure safe, effective patient care, delegating and assigning patient care, collaborating and coordinating patient care, and teaching. In this position, the RPN is still required to role model professional nursing practice. Part of the role of the nurse is to assign and supervise care. This is a necessary skill that ensures necessary duties and responsibilities are completed in a timely manner. This is typically one of the new skills nurses learn on entry to practice. Nurses may also be required to teach procedures or skills to unregulated care providers. The College of Nurses of Ontario explains that assigning is the act of determining or allocating responsibility for particular aspects of care to another individual. Typically, when an assignment is created, it includes a range of care procedures for a group of patients. The most common assignments RPNs create is for unregulated care providers. These aspects of care, for example tasks, skills or procedures, might or might not be controlled acts. The nurse must have the necessary knowledge, skill and judgment. Supervision is the act of monitoring the actions or activities of others, directing and or watching what might have been done or what has been done and how they have been done. Supervision can be direct or indirect. Direct supervision means the nurse is present during the provision of care, observes and perhaps directs. Indirect supervision means that the nurse is not always physically present, but includes intermittent direct observation and or reporting back by the care provider to the nurse. An example of this might be when the RPN in a long-term care facility supervises an unregulated care provider disconnecting a G-tube feed when completed. The RPN directly supervises the procedure to ensure it is completed correctly and safely. Teaching is a procedure which includes the following: providing instruction about a procedure, task or skill, and determining a person is competent to perform a procedure, and evaluating learning. Teaching is not the same as delegating because it does not transfer authority of any controlled act. The CNO Practice Guideline, working with unregulated care providers, explains when teaching is required. There are 6 requirements for teaching. Requirement 1. The nurse has the knowledge, skill and judgment to perform the procedure competently. 2. The nurse has additional knowledge, skill and judgment to teach the procedure. 3. The nurse accepts sole accountability for the decision to teach the procedure after considering the known risks and benefits, the predictability of outcomes, the safeguards and resources, and any other factors specific to the client or setting. 4. The nurse has determined that the UCP has acquired through teaching and supervision of practice the knowledge, skill, and judgment to perform the procedure. 5. The nurse may teach the procedure to a UCP to perform for more than one client if she or he has determined that the factors in requirements 3 and 4 are conducive to performing the procedure for more than one client. 6. Considering the factors in 3 and 4, the nurse evaluates the continuing competence of the UCP to perform the procedure, or reasonably believes that the mechanism is in place to determine the UCP's continuing competence. If a nurse is also delegating the controlled act to the UCP, see the section on delegation in this document and the authorising mechanisms practice guideline for additional requirements the nurse must meet. Nurses often ask when they have the right to refuse an assignment discontinue a client's care, and what constitutes abandonment. The Employment Standards Act of 2000 states that employers are responsible for establishing a work environment that supports safe, effective client care. The Occupational Health and Safety Act explains the criteria for refusing to work when the health and safety of the worker is of concern. The right to refuse to work in unsafe conditions is limited to certain professions, nurses being one of these. Nurses cannot refuse to work if by doing so they will directly endanger the life, health, or safety of another person. The following CNO documents outline nurses' responsibilities and accountability: the professional standards, ethics, legislation and regulation, and introduction to the Nursing Act. Although there is no specific mention of the term abandonment in the Nursing Act, there are descriptors of what would constitute professional misconduct. These include abandonment. Nurses have the right to refuse extra shifts or overtime. This is not considered abandonment. However, it is important that nurses review their employment contracts, as there may be clauses that obligate the worker to accept shifts on certain days, times, or the number of shifts per pay period. Abandonment occurs when a nurse has accepted an assignment and discontinues care without 1. Obtaining the client's permission, 2. Arranging a suitable alternative or replacement service, or 3. Allowing a reasonable opportunity for an alternative or replacement service to be provided to the client. What should a nurse consider when choosing whether to refuse an assignment or discontinue a service? Firstly, and most importantly, is the safety of the client. The nurse must consider all the facts and factors in the situation, which includes accountability, the nurse's right to refuse, Ontario labour law, and the nurse's legal contract to an employer. Nurses are not obligated to work extra shifts or assignments. However, it is important to remember that nurses must advocate and protect client safety and clients with ongoing care needs, who are entitled to have those needs met. To resolve dilemmas caused by conflicting obligations, nurses must effectively communicate and collaborate with the team, management, and the employer. The College of Nurses describes in detail how to implement these 4 steps. This information can be found on pages 6 and 7 of the practice guideline. There are 5 scenarios present at the end of the practice guideline refusing assignments and discontinuing services. Please look over these. This is your opportunity to assess your learning. Please read the questions and see if you can come up with the answers.